This is an example of which, because of a single tooth, the adjacent teeth are getting affected. The adjacent teeth are getting infected. So when we say, don't ignore an infection on one tooth, this is what we're saying. Because had she not ignored this and, got the treatment earlier, we would have probably been able to save a lot more teeth. So these are very special cases. I always say dentistry is all about neglect. The longer you neglect, the bigger the problem arises. So any small pain, any small sensitivity, when the doctor advises you to get something done, get that done and get rid of all that infection, because this infection not only spreads to your other teeth, it spread to your other organs in your body also. Here is a case where this young girl has been suffering from multiple bouts of swelling on the face because of this, periapical abscess, what we typically call it in our language. That means, though the root canal was done, there is infection so much that, her whole face used to swell every 6 months. She used to take some medication, then come back. So when we examined, we found that this has become like a cystic lesion, a huge abscess on one tooth, and this is what was causing this regularly. So this is a surgical procedure where we've done opened up the flap, we cleaned up all these abscess and the cystic lining that was there, the complete cyst, and removal of the tooth, because that was a primary source of infection. The other three teeth which were also involved, apicoectomy, that means, at the end of the root we have removed that and cleared all the infections, 3 centimeter diameter bone defect that was there, and we had to clear it all off, send it for biopsy, waiting for the biopsy report. But she can not have any of these such symptoms or any of these infection again ever coming. So that is what has been done, and she's been recovering now pretty well. But in such cases, this is the best solution.